Good afternoon or good morning, depending upon where you are. Welcome to today's webinar on things you don't learn in graduate school, how to prepare for success in licensed professional practice. This webinar is hosted by the APA Practice Organization. My name is Nicole Owings-Fonner, and I'm a Communications Project Manager in the Practice Directorate at APA. I will be moderating today's webinar. This webinar is being recorded. A copy will be emailed within 24 hours to all participants and those who registered but could not join the live presentation. If you'd like to follow along, a handout has been provided in the handout section of your GoToWebinar column. Today's webinar will cover topics that are not typically covered in graduate school, but that you will need to understand in order to be successful in professional practice. We'll cover licensure, billing and reimbursement, legal and regulatory issues, and there will be multiple opportunities for questions during this webinar. Please use your chat box to submit questions at any time during the presentation. Our presenters today are Dr. Maysa Akbar, Dr. Lynn Bufka, and Mr. Tyler Bradstreet. Dr. Akbar is a licensed psychologist and board certified in clinical child and adolescent psychology. She is the CEO of the Integrated Wellness Group in New Haven, Connecticut. Dr. Bufka is the Associate Executive Director for Practice Research and Policy at the American Psychological Association. In addition, she is a Maryland licensed psychologist and continues to provide treatment and clinical consultation on a limited basis. Mr. Bradstreet is wrapping up his internship at the University of Maryland School of Medicine in the Adult Outpatient Psychiatry Integrated Health Track. In August, he will begin his new role as the Director of Psychology within the Texas Tech University Athletics Department's Sports Medicine program. He is also the graduate student representative on the Committee for the Advancement of Professional Practice within the APA Practice Organization. I'm going to turn things over to Tyler now to start.
Thanks, Nicole. Before we begin, I wanted to take some time and talk about where the idea for this webinar came from. I began my appointment as a student member of CAP, or the Committee for the Advancement of Professional Practice, during the first of 2017. CAP is part of practice organization governance, and its members help to identify, plan, and implement projects that are important to the protection and enhancement of professional practice in psychology. I sought out this position on CAP because while I enjoy providing mental health services in the therapy room, I wanted to be at the table for bigger picture discussions and be an advocate for our profession. I think this is particularly important now in an ever-changing healthcare landscape, where we aren't the only profession fighting for position in the mental health space. So as I began my time on CAP, I quickly learned that being a member of CAP came with a steep learning curve, especially for a graduate student. What did I really know about professional practice? Now, I truly believe that my APA accredited training taught me how to do therapy extremely well in the room with the client and help them improve their mental health and well-being. But I don't think it really taught me how to be a psychologist in professional practice within the real world. The way it seems now is that you were to learn about professional practice issues starting during your postdoc years and continue as you move through your early career stage. However, I believe that this learning needs to come sooner to ensure that we hit the ground running right out of graduate school. Now, I don't know that we need to be adding more required classes to our graduate training and spending more time in school, but we do need to get this information from somewhere. And that's where the idea for this webinar came from. The Practice Organization is an amazing resource for all things professional practice, even as a graduate student. So today, I wanted to have some amazing people provide an overview of just a few of the important professional practice issues that psychologists need to know about to be successful. And now, I'll turn things over to Dr. Lynn Bufka to talk to you about licensures.
Hello, everyone. I am delighted to be part of this webinar today and look forward to hearing what some of your questions are about. Like Tyler, I think there are a lot of things that I did not learn in grad school that I wish I had learned prior to trying to get out there and practice in the world on my own. My supervisor said, well, these are the kinds of things you learn as you do them, but it would have been nice to have a heads up about some of these things coming my way. So we're going to start with licensure first, because for many of you, that will be the next step once you finish internship or postdoc is to begin thinking to, hopefully you've already been thinking about licensure, or for people who are early career. The practice of psychology is protected by state laws from one state to another. Every jurisdiction has regulations that each state, the professional licensing board or an omnibus licensing board, determines who can be a licensed psychologist and what are the rules for that. They're pretty similar from one jurisdiction to another. And I say jurisdiction because that's also going to include the territories and the Canadian provinces, because we have some mobility across all of that. So within that setting, all jurisdictions, for the most part, require a doctoral degree for independent practice as a licensed psychologist. There are some limited issues for individuals who have less than a doctoral degree in the psychology practice area, but the majority, it's a doctoral degree for independent practice. There is an expectation about supervised experience, but it varies from state to state, sort of how that gets spelled out. And nearly all jurisdictions require that you pass the EPPP, the Examination for Professional Practice in Psychology. That is not administered by APA or the APA Practice Organization. That comes from the Association of State and Provincial Psychology Boards, which, as you would expect from the name, all of the state, territorial, and psychology boards, provincial psychology boards, belong to this organization. And that's where those people who are generally psychologists, who are very active in the licensure of psychologists, meet to talk about issues related to regulation and licensing of psychologists. So despite some similarity among licensing laws, there are differences that are important for individuals to know about when they're looking forward to licensure. So definitions of approved training programs may differ from one jurisdiction to another. In general, across the states, territories, and provinces, APA and Canadian Psychological Association accredited programs for doctoral programs are the norm. There will be some differences in terms of how internship or postdoc have potentially been defined. So it's important to know that, because you have committed to a particular graduate program or internship or postdoc, and you'll want to know how it's been accredited, how it's defined, that kind of thing. Then there's also the question of supervised experience. Generally, you're going to have to document some supervised clinical experience, but there's going to be some variability, and to the extent to which that experience can happen pre-internship, on internship, or on postdoc, and also some variability in terms of who may provide the supervision and under what circumstances. For instance, in Maryland, some supervision can be provided via technology, but not all supervision. I remember when I was getting licensed in Massachusetts, there is a required amount of supervision per amount of clinical time. So you'll want to know that and ensure that your experiences meet those requirements. And then every state has the option to have additional examinations, such as a jurisprudence exam, an exam that gets at the particular license laws specific to psychology practice within that state that you may have to take, or some states have had oral exams that you may have to take. So it's important to have an understanding of what could be expected of you when you head towards licensure. So I noted about the Association of State and Provincial Psychology Boards, ASPPB, and there's a lot of acronyms in the world of psychology. So they have some really good tools online that I would encourage you to check out. So they have an online reporting tool where you can get into what are the requirements and begin to think about how are you going to track this and record this for the future. If you have a pretty good idea of what state you are likely to seek licensure in, you would want to go online or contact that board to get some answers about what the requirements are, because that's going to help you to be more prepared for when you actually apply for licensure. You'll also want to know a little bit about this concept that is called reciprocity. And reciprocity has to do with the rules for a psychologist licensed in one jurisdiction to become licensed in a new jurisdiction. So this is particularly relevant if you are licensed somewhere. I was licensed in Massachusetts, I moved to Maryland. What do I need to do in order to become licensed to Maryland? Because I'm already a licensed psychologist. So I didn't have to take the EPPP again. But I had to provide other documentation about my training. So it varies from one state to the next. Sometimes it's very readily accepted. Sometimes there's additional requirements. We would love to see reciprocity be pretty universal, that if you're licensed in one state, it's very easy to become licensed in another state, but that's not consistent from one jurisdiction to another yet. The State Psychological Association can also provide you with some information on professional issues affecting psychologists in your region and the kinds of things that might be impacting them at a licensure level or at a professional practice level, or requirements about certain kinds of documentation expected in the state. So your State Psychological Association can be a really good connecting point and resource for information that you will want to know as a licensed psychologist in any particular jurisdiction. And it doesn't matter if you're in independent practice, private practice somewhere, or if you're with an organization. The state psychological associations are out there trying to protect psychology as a discipline and a practice. So they're a great place to get involved. So you can Google for it, or you can go to the link that's on the slide to find the addresses and contact information for state psychological associations. So to prepare for licensure, one thing, make sure you're meeting the education requirements. So you know it's going to be a doctoral degree. It's going to be from a regionally accredited or government chartered institution. And typically it's also going to be accredited by either APA or CPA. That's going to be the easiest route. If you're not from an accredited, an APA or CPA accredited institution, you're going to have to prove that your program meets those requirements. That is the equivalent of that. You're also going to need additional materials. You may need to document the number of clients you've treated over time, the types of problems, what kind of supervision you've had, what your internship experience was like. Some states you may even need this. You may even be able to use this from practicum hours to count towards your supervised experience for licensure. Other states, it's only internship and postdoc hours. Some states require the postdoc hours, some don't. So you're going to want to really think about that and be tracking that very carefully. And if you think you may move from one state to another, keep that record for some time. You may also need to provide proof of coursework, particularly as I noted, if your program is not accredited by either the APA or the CPA. And then you have these tests you have to take. The EPPP is one of the tests that you will certainly need to take. It's a multiple choice test. I think everyone kind of freaks out over having to take the EPPP. I know my cohort, we all were anxious about having to take the exam, because you may know an awful lot about particular areas of clinical work and practice, but remember those core courses that you need to take as part of your doctoral training, those can be covered on the EPPP too, and you may be worried that you've forgotten those things. So you're going to have to take the EPPP. You have to apply, generally you apply for licensure in order to be given the opportunity to sit for the EPPP. And most states require either a 70% or a 500 on the computer-based exam. When possible, you know, we encourage states to allow applicants to take the EPPP as soon as they can after completing their coursework, because that tends to be more beneficial for them. Some states will let you take the EPPP even if they require postdoc hours. They may let you take the EPPP once you finish your degree, but before you finish your postdoc hours. But the sooner you can take the EPPP, the closer it's going to be to the graduate coursework you've taken, and the more you'll have that retained in your head, and you'll feel more confident in taking the exam. So, and as I noted earlier, you may also have to pass some sort of oral exam, and most states are going to require some sort of law and ethic exam specific to the rules and regulations in their states. You may have heard that a new exam is on the horizon. It's called the EPPP2, or the Examination for Professional Practice in Psychology, Step 2. The current EPPP is all multiple choice. It's a knowledge test. You know, it's a lot of the kinds of things you may have done on a GRE subject exam, things about diagnosis, things like that. Whereas the EPPP 2, the step 2, is intended to be focusing on skills. What are the kinds of things that you actually need to be able to do as a licensed psychologist? ASPPB has announced that when it's released, those students from accredited programs who completed all the necessary coursework would be able to take the EPPP Part 1 prior to graduating. So you would then be able to take that knowledge exam closer to your coursework, and then you would take the skills part, the second part of the exam, at the time that you're applying for full licensure. So it's anticipated that there will be a 2-step process that might be separated by, a year or more, depending on when you finish your coursework and then when you finish all the other requirements for licensure. And ASPPB is expecting to have this exam available in January 2020. Now, different states the timeline for when it gets implemented in different states and jurisdictions, it doesn't mean that it will all happen necessarily beginning in January 2020, because states will have to change their procedures for how they go about licensing individuals. We do have a blog post on that topic that you may find useful, and I would just encourage you to stay tuned to pay attention to what's happening with that, so you know what to anticipate for when you're likely to be licensed. We don't know yet a whole lot about what it's going to mean for people who are already licensed but relatively newly licensed and looking to get licensed in another state. There's more things that we're trying to learn about how this process will unfold, but this process is fairly consistent with what other disciplines require in terms of both knowledge and skills kinds of assessments as part of licensure. As you should know, and I'm sure you're doing this, you need to accrue your your supervised clinical hours prior to licensure. Many states require that you have pretty good details about what those hours involve. And you may have found it useful if you're preparing for internship to have some detail about the kinds of clinical experiences. So hopefully this is something you've been doing all along. But the number and type of supervised clinical hours could vary by the state you want to practice in. Michigan requires 2,000 supervised hours. California requires 3,000 supervised hours, and this is in total. So you need to know whether you can get your hours all prior to graduation, so including internship, whether you need to have a formal postdoc training program, whether if you're working under an investigator's clinical research grant, how those hours might count towards licensure, or whether you could be getting additional hours post-internship on a job in a clinic somewhere or with a private practitioner that might count towards postdoc hours if you need that kind of work, kind of documentation. So you want to be really careful with documenting where your hours came from and how you acquired them. Professional mobility is a big issue. 50 years ago, people didn't move around from one state to another. So states were a lot freer to come up with what was important for their particular state for licensing. But most of us move. We may be licensed in one state immediately after internship or postdoc, and 5 or 10 years down the road, a great opportunity in another state comes up, or we decide we want to practice, move closer to family. So we may move, and we may need to get licensed in a new state, or we may need to practice in another state on a short-term basis. This is particularly true for those who are providing some expert witness in legal proceedings, or might be pursuing some sort of interesting part-time opportunity on a short-term basis. Or maybe you're in a small state and you have the opportunity to have a secondary location that might be across a state line, or you're near a state border, so you might be straddling 2 jurisdictions. There's also questions about how many states and how many places should you be licensed in if you're providing services online via technology. Typically, you're expected to be licensed in the state or jurisdiction where the patient is located, not necessarily where you are located. So lots of questions to think about in terms of mobility and where you should be licensed. So because there is a lot that you'd like to learn and know about in terms of the practical points of it, Tyler's on the ground right here with what it involves. So he's got some good ideas for what might be next.
Thanks, Lynn. So I just wanted to point out some key takeaways. Overall, I think it's it's just really important to recognize the variability from state to state in licensure requirements. And really, to the extent possible, think and plan ahead. Do so as early as when you're considering where to apply for internship. A lot of internship training sites also have associated postdoctoral training programs, and often people at an internship site will stay at the same place for their postdoc. So ask yourself, is this a state where I see myself staying in? What are its licensure requirements? Or is your ideal postdoc that will give you that desired training that you want, is it in a different state than where you anticipate living and working afterward? What are the differences in their licensure laws? Will that be an easy transition to make? Also, consider at what point after graduation that you plan to apply for licensure. Unfortunately, as with grad school, it's an expensive process. And for those close to graduating now or already on internship or postdoc, the EPPP Part 2 is coming up in January of 2020. That'll be an additional cost. So consider whether you want to get licensed before it goes into effect or after. And last, you still need to track your postdoctoral hours. Licensure will require a lot of important information from you. Consider banking your credentials with a place like the National Register of Health Service Psychologists to keep track of that important information when you need it for licensure or for when starting a new job. And briefly, I can tell you how my experience is going. So as it's been said, I'm in the last days of my internship and I've taken a clinical job in Texas. And, I'm doing that work and figuring out what I need to do. So in Texas, the first step is to apply for a provisional license. And to get that provisional license, I need a doctoral degree from an approved program and an approved internship, pass the EPPP, and pass a state jurisprudence exam. After that, to be able to apply for full licensure, I will need to have obtained that previously mentioned provisional license and obtained 3,500 hours of supervised experience, half of which can come from internship and half of which has to come postdoctoral. But in Texas, it doesn't have to be from a formal postdoctoral training program. So while I am taking a job, in some ways it's also doubling as an informal postdoc, as I'm having to secure a supervisor to oversee those postdoctoral hours to become fully licensed.
Okay, well, right now we're going to go ahead and ask our presenters a little bit more information, some specific details that have come in. Thank you, Tyler and Lynn, for what you've already shared with us. Someone has asked that, Tyler, could you please repeat what registry you just mentioned for folks to keep track of their clinical hours?
Sure. So I don't use it specifically to keep track of my clinical hours. I use my time to track. But in terms of keeping all of that information together, so including your the completion of internship, different types of documentation, you can bank your credentials with the place that I use, which is the National Register of Health Service Psychologists. There's other places that offer those types of services to psychologists as well. That just happens to be the one that I chose to keep all that information together. And it just allows for more of a seamless process of being able to provide particular documentation to a state licensure board or to a hospital that's looking to see if you're credentialed in an appropriate way.
Thank you. I believe that ASPPB also has a credential bank if you're curious in checking out their information. We have another question from the audience. When is it best to take the EPPP?
Well, this is Lynn. I would say, if you're eligible to take it sooner, go for it, because the EPPP, as it currently is a knowledge-based exam. You will have been closest to your course content, as a graduate student, and going into internship. The longer you wait before you're taking the EPPP, the knowledge portion of the exam, the more distance been from that kind of learning that you've done. And so you may understand all those concepts, but you may not remember some of the details of it. So if you're able to take it earlier in the process, I would certainly encourage that.
And this is Maisa. I would absolutely co-sign that and say that there are some states that allow you to take it depending on the number of hours that you've already accumulated. So for example, I got licensed in the state of Connecticut, and while my internship didn't end till June 30th, I was able to take the exam somewhere around like April or May, because I had already actually accumulated my hours by then. So you don't have to wait to the completion of your internship to sit for the EPPP, as long as you meet the state requirements and the national requirements.
Thank you. One final question on this section is, do you guys have any recommendations for practice materials for the EPPP, or where they should find study materials?
I'm going to defer to people who are younger than me and took the exam more recently.
So this is Tyler. I haven't taken the EPPP just yet, and I don't have a good answer for that. I just my advice would be to ask people that you know that have already taken it. I just got some material from someone else that was generous enough to provide that. I'm not particularly sure where it was from, but it was something that they paid for and that I paid them to be able to use as well.
This is Maisa. I'm about 15 years out, but I can tell you what I remember. I tend to be more of a hands-on learner, so I didn't want to take the only route of studying through written materials. I actually also got audio, which I listened to even when I was sleeping, like at all times. And then I did a 4-day crash course. Again, I'm from Connecticut, but I did it in New York. The classes were about 10 hours a day. And what that was able to help me do, I did it towards the end of my studying, about 2 or 3 weeks before I sat for the exam. And, whatever I wasn't able to learn during the time that I was doing independent studying, I was able to grasp it during that time. And so it was very successful. I sat for the exam about 2 to 3 weeks later. I passed with no problem. But, I think that you have to understand yourself and what modality you learn best in, and make sure that you use various modalities if that's what's necessary, so that the information sticks.
And I will say, you had a study group with several of my peers, and I found that very helpful because it made me accountable to showing up and to reviewing and to working on thinking about questions and topics. It also gave me just some support because everybody's freaking out about it. The other thing that I will say is, definitely, if you have a jurisprudence exam, that material will be separate from the material for the EPPP. You typically will get that from your licensing board. Study it, because they'll ask you some random questions you're not expecting. I did not pass my jurisprudence exam the first time because I hadn't read the material at all, because I was so worried about the EPPP. And I remember one of the questions was, how many CE hours do I need to renew my license? Which seemed like a ridiculous question to be asked for a license exam, because that's the kind of thing you look up. That's not the kind of thing that I figured you'd have to know in order to actually do clinical work. But yes, I had to know that on the exam, and I did not give the right answer to that one.
All right. Well, thank you guys for that information. Looking at the clock, we're going to go ahead and keep moving to our next topic.
And while we move to the next topic, I was just reminded also that the ASPP website is a good place for EPPP information. Sometimes you can even see some sample questions, things like that.
Thanks, Lynn.
Sure. So we're going to talk about billing and reimbursement. This is important. You want to get paid for what you're doing. And this is the area that I think is pretty mysterious for most of us in the area of clinical practice. So we put some really basic information in here. Those of you who are already providing clinical services may be familiar with this. Every healthcare service has a current procedural terminology code called a CPT code. This is true for mental health care. This is true for behavioral health care. This is true if you go to your primary care doctor for a checkup. There are codes for every kind of health condition out there. There are a number of different procedure codes for different kinds of psychotherapy, like individual or family or group. There's codes for diagnostic evaluations. There's specific codes for psychological testing and neuropsych testing. The psychotherapy codes were modified about 4 years ago, and the times, they come in chunks of time of an average of 30 minutes, 45 minutes, and 60 minutes or more. And they're, it's like 37 minutes to 53 minutes surrounds the 45. But basically think of them in 30, 45, and 60 plus minutes lengths. And these code numbers and descriptions for these were changed around the psychotherapy codes and the diagnostic codes in 2013. We expect changes to other codes like the health and behavior codes and the testing codes that psychologists frequently use. We expect revisions to those as well. It's a continual process for trying to keep the current procedural terminology up to date for what's really happening in healthcare practice. So I couldn't remember if it was on this, if we talked about it or not. Just so you know, APA, it provides commentary and expertise about CPT codes. We do not create those codes or have much influence over changing codes. We work hard with the AMA, the American Medical Association. They own the codes, and they are the ones who work with Medicare and other organizations to help establish what the codes are. So it's not something that APA creates all by itself. We are a small little player in the idea of what CPT codes are. I bring up Medicare because it's really important. Medicare is a federal health insurance program for people who are 65 or older, or who have some sort of suffer from stage 4 chronic renal disease. It's administered through the Centers for Medicare and Medicaid Services, which, believe it or not, is actually CMS. It's not CMMS. So it's an agency within the U.S. Department of Health and Human Services. Medicare is important because what happens in Medicare often gets mirrored in other kinds of payment programs. So we do pay a good amount of attention to Medicare. Next slide, thanks. So Medicare will cover diagnostic evaluations, inpatient, outpatient psychotherapy services, psychotherapy for crisis situations, psychoanalysis, but there are some restrictions or limitations on when and how the service can be billed. And this is true for all third-party payers, insurance companies, and others. How does Medicare decide on fees? So the American Medical Association, those people who bring you the CPT codes, they have a system called the Relative Value System Update Committee, or the RUC. And there's a tool that they use to try to collect data from healthcare providers to try to be a little more objective about the energy, the expertise, the costs that go into providing a particular service. And then they determine a value for that service. They assign a RVU, or a relative value unit, for every single CPT code. And of course, all of us who provide a service suspect our service is not valued as highly as it could be. But we're looking at this from the point of view of psychologists and cardiologists, emergency room physicians. Everyone's concerned about, are the services that they routinely provide appropriately valued? And within the whole system of Medicare, there's only a set amount of money. They have to pay for all of healthcare, and they will try to do it fairly and try to ensure that all of the different kinds of services relative to one another are appropriately valued. So anyway, the RUC then recommends to CMS what the RVUs for all these procedures and codes should be. And then these RVUs are multiplied by a set dollar figure to determine what the actual price will be that people would get reimbursed for providing that service. So things like, what's the professional work involved? What's the practice expense? What does malpractice insurance typically cost? We have more practice expenses for testing because we have to buy testing supplies than we do for psychotherapy. We don't have as many supplies you would need for psychotherapy relative to testing. So the practice expense is likely to be more for testing codes than for psychotherapy codes. So that gives you kind of a big picture idea of how fees are determined through Medicare. And I noted that this is important because Medicare often sets the stage for other organizations. So the Centers for Medicare and Medicaid Services, CMS, approves these values. They look at it on an annual basis. It goes into effect in Medicare and other federal programs, and then commercial insurers and Medicaid look at these codes also, and then think about how should we value these services within our payment system. So even if you don't provide any services under Medicare, even if you're not in a private practice payer where you're directly being paid through insurance, your organization's payment for clinical services is going to have some link to this CPT, AMA, RUC, RVU process. So I hope you like all those acronyms. But that's why it's important to really understand what's happening there. So then you've got commercial insurance. We thankfully have mental health parity now. The Mental Health Parity and Addiction Equity Act is something that APA worked very hard, APA and the APA Practice Organization worked very hard to get that to pass, because it used to be that services for physical health care could have different rules for how they got reimbursed and the types of copays than mental health. But this now requires that if there's a group health plan that provides both medical and surgical benefits and mental health or substance use benefits, it must ensure that the financial requirements and the treatment limitations are applicable across both and are no more restrictive than the requirements for medical surgical benefits. This means you can't have higher copays to see a therapist than to see your primary care doctor, that you can't have arbitrary limits for one versus another. So these are really important things to know. So these are the key points of mental health parity. In addition to the copays not being separate amounts, psychologists aren't considered specialists. Psychologists and other mental health providers are sort of in that group of like, it's important to see these folks, just like you would with a primary care doctor, so they can't have higher copays for us than for a primary care provider. There's also an expectation around out of network and parity. So if the health plan provides out-of-network medical benefits, meaning it approves for one of the covered lives, that's the language they use, a patient who has health insurance A, it approves for them to get care from somebody who is not a provider through that health insurance for the physical health care, they must also provide at parity that same kind of benefit for mental health and substance use disorders. So that's important as well. If there are deductibles or out-of-pocket maximums, you can't make different requirements for mental health substance use benefits versus other healthcare benefits. So these are key points of mental health parity that we're happy are passed at the federal level. So in commercial insurance, you can have managed care contracts. This is whenever a psychologist agrees to be a provider under contract through that insurer to deliver services to the people who have that insurance. So most of us have physicians of some sort or another, or primary care providers. We may have health insurance, and we are very aware that of whether or not our primary care provider accepts our insurance. It's the same thing with psychologists. Does a psychologist accept my insurance? Does this healthcare organization accept the insurance that I as a patient have? If you've signed that contract to accept that insurance, it's easier for patients then to come see you, but it also creates some obligations for you as a psychologist that have the force of law. So you really want to be sure to read the provider contracts before you sign them. I know we all know that about contracts, but it really is important to read the contracts carefully and make sure you understand what it means, and make sure you're willing and able to meet those requirements before you sign the contract. And keep a copy of that contract. Make sure it's accessible in case there are any issues. So you keep a copy of all the materials that are incorporated by reference into the contract too, any separate documents, anything that defines what's considered medically necessary. Those are all important documents to have as well. And then you'll want to know what's the state entities that you talk to about any perceived unfair practices. There's typically an insurance commissioner of some sort in every state, or an agency that has a similar name like that, that's responsible for overseeing all of the insurance that's provided within that state. And they are the ones who often can address concerns that providers might have, professionals might have about contracts, and perhaps work with you to resolve any conflicts with those contracts. If you're accepting insurance in your practice setting, or if you're in an organizational setting where insurance is accepted, what happens is there's a claims process. You know, most of us understand it from sort of the physical health care that we receive, that we might go in and pay a copay and they get our insurance card and then the office does something on the other end. Well, now you could be the provider with the office on the other end doing something. A claim submission goes to the health plan. The company checks to make sure it's a valid claim, to make sure that you're providing a service that maps onto the kind of diagnosis. For instance, they're not going to want to see psychotherapy for some sort of cardiac problem. They're going to expect to see psychotherapy as being provided for some sort of mental health or substance use problem, for instance. So then they look to see if, make sure that service is covered under the health plan, and then they'll provide some sort of information to you, a remittance advice to the practice describing, you know, what's being paid or not. And then most of us as patients have received explanation of benefits telling us about what was performed, how the payment was settled, and that also practices will get, and the insurance client gets that as well. Navigating this is not always easy. There are some pitfalls. I think this graphic captures it very nicely, of the professional leaping over the ravine. It's shaped like a $sign, but boy, that one can be a tricky one. There are opportunities for errors and for delays in many ways. Sometimes you don't get paid for something, and it could be because the health plan never received the claim. It could be because the codes you entered were incorrect or missing. It could be because specific information about you, the provider, or the patient isn't included, or information about the health plan is incorrect, or perhaps the plan doesn't cover the service. The plan could just say, we don't cover this kind of care at all. And there can also be errors or delays on the part of the payer that delay processing. So there are all kinds of places where this process doesn't always go smoothly. So, and then there's also self-pay. Lots of self-pay out of the pocket. So this is when somebody goes to see a psychologist and they're paying it for themselves, not paying to third-party payers. So third-party payers typically don't cover areas such as divorce mediation, conflict resolution, child custody kinds of evaluations. That's in the forensic area. It's a prime market for psychologists who are looking for self-pay options because people need the services and they can pay you directly. Organizational consulting is an area that's certainly not covered by insurance. That's a lot of self-pay, and life coaching as well. Those of you considering life coaching, really encourage you to look up on what the boundaries and ethical issues are between sort of mental health practice and life coaching. But coaching is not something that's paid for out of other reimbursement. It's a self-pay process. So traditional mental health can also be self-pay. There are clients who will want to pay out of pocket instead of using insurance, and it could be because they want to see you and you don't accept their insurance. It could be because they don't have access to the certain kind of provider that they want to see. Some people are concerned about confidentiality, whether they've got some sort of security clearance they're trying to protect, or some certain information that they want to make sure is not in any sort of health record that could go to a third-party payer. So there are some who do pay out of pocket, self-pay, and pay the psychologist directly for the services. So sliding scale, some people opt to do this. Some opt to have some managed care insurance, some people and self-pay, and then they opt to give some sliding scale options to people who can't afford it. You want to make sure you're not violating any managed care contracts you have. They may have some provisions in there about what you can charge to individuals, and if you charge a different amount to some individuals and to others with insurance, that there may be concerns there. You don't want to waive co-insurance payments or deductibles because it could be considered fraud. And if a third-party payer thinks that you're valuing your services for them at $200 an hour but $50 an hour on your sliding fee, they may wonder, are you appropriately valuing your services? So keep a paper trail of whatever you decide. So now I'll turn it over to Dr. Akbar who's been in practice and has some points and tips to share with everybody.
Hi, everyone. I'm Dr. Akbar, and I have been in private practice now going on to 10 years. I actually have a pretty large group practice, about 30 or so clinicians, both master's level and doctoral level clinicians. I decided to open a private practice pretty early on in my career after completing my pre and postdoc. I did spend 3 years in a community mental health clinic, which actually was a very good training experience for me to understand what it would take to open up a practice. And then I also made sure that I became a student of billing and reimbursements, just like the slides that were presented to you, because if you don't understand the nuances of billing, then it gets very complicated, not just for you to do it as an independent practitioner, but also for you to help others that are in your practice. Now, there are different kinds of practice. You can be a solo practitioner and have just a practice on your own. There are some liabilities around that only because the income is solely dependent on you and how many patients you see. And there's always no shows or cancellations that may affect the number of encounters that you finish during the week. There's a group practice which you can join, and these are all independent practitioners that sort of just really share office space, and so you don't have to labor the cost of office space and overhead, maybe even a receptionist to keep appointments. And then there is a clinic type of practice, and I decided to go for the clinic and build my practice over time. So I started really with, 1 to 2 people, myself and another clinician, and over the last 10 years have built it to 30 clinicians. And so you can think about what your strategic plan is and whether this is something that, you want to do at a very small scale or something that you'd like to do at a very big scale. And for myself, I was very invested in not just psychology and understanding it as an expert in the area, but also entrepreneurship. There are some caveats that I want to talk about in terms of billing and reimbursement. For the state of Connecticut, which is where I practice, they have not changed the amount of reimbursement specifically for state-funded insurance for the last 10 to 15 years. And so as you can consider, inflation, the cost of living goes up, all of these things are going up, but the reimbursement rate has not changed. So sometimes it can make it complicated to stay in business. One of the primary things that I would suggest is that you diversify your income that is coming in, what we call your revenue that's coming into your business. So just to wrap it up, I want to just identify that if you are going to be successful in private practice and you're not independently wealthy and doing this just for, just as a side hobby, and you want to make an investment in growing your entrepreneurial small business, that if you choose to do the billing and the therapy side of it, which we consider the commodity side of the business, it is the quantity that helps to drive revenue. And if you want to see a net profit, which is how much money is left over after your expenses, I would consider something that we call the niche part of the business, which is creating innovative programming. For example, one of our innovative programs is that we provide behavioral health consultation to the school district. We set a price of how much we're going to charge for that, and then we have our trained clinicians go out and do the behavioral health work right in the school system. That's a niche type of service that you can provide, and then you set the price rather than the insurance company setting the price. That offsets the cost of doing business, just specifically focused on treatment and reimbursement alone. I think that I'm going to wrap it up there because I want to make sure I stay within time, but certainly if you have any questions, feel free to ask.
Thank you for that, Dr. Akbar. We're going to go ahead and go on with our legal and regulatory issues and then cover a few questions that were submitted at the very end.
Great, thank you. Legal and regulatory issues are a big topic as well. We're covering a small slice of it in this presentation. Hopefully you've all heard of HIPAA, the Health Insurance Portability and Accountability Act. 3 main rules that are part of that: privacy, security, and breach notification rule. So it's important that you are HIPAA compliant, whether you are practicing on your own or practicing within some sort of organization. Next slide. So the HIPAA privacy rule, that sets the minimum standards for your intended disclosure of information, right? As psychologists, we're pretty trained in this area. We know not to disclose patient information. This was something that was a newer concept for other parts of healthcare when HIPAA was first enacted. Psychologists take this very seriously. Healthcare providers do as well, but I think all of us are familiar with, at least in the television shows where there's patient conversations happening in the elevator in the hospitals, they run from one place to the next. We don't want to do that. We don't want to just say, I can talk to this physician because we share a patient. We as psychologists are pretty trained that that's not okay, but HIPAA set up the requirements around this, like when can you disclose information, what kind of consent or authorization is needed for that, and when no consent is required to disclose patient information. Our laws often cover that as well, because we all know that there are instances in which safety of individuals trumps the privacy of the individual. So it's important to know those issues very clearly for wherever you're practicing. It's also important to know what's the scope of patient information you can disclose. Perhaps all you can disclose is that, yes, you're seeing that person and they're in psychotherapy, or it may be that you can disclose more information, and that privacy rule helps us to understand those issues as well. We also have the security rule. This is how do you keep that stuff secure? Again, I think as psychologists, we've been pretty well trained in this, that we don't leave files around with patient names on it, that we have locked file drawers, things like that. But the security rule really goes through this very carefully. And it's really important when you've got electronic information as well as paper information to understand how to keep all of it secure. You don't have individuals sign in at a front desk where their names are clearly listed, because then their personal information has been potentially conveyed to other individuals. So you've got to have, actual physical ways to keep data information secure, administrative processes where individuals are not inadvertently sharing information because they're checking in with the receptionist, the technical procedures in terms of ensuring offices or files or computers are locked when they should be, that they're password protected, those kinds of things. And the privacy rule applies to protected health information. The security rule applies only to the electronically transmitted or stored protected health information. So all personal health, protected health information, the privacy rule applies to, whether it's paper or electronic. Security rule really addresses the electronic transmission and storage of health information. The breach notification rule. So sometimes there are data issues. We've all seen this with, Target got hacked and consumer information is out there. Well, this can happen in healthcare as well. There could be a data breach. The data breach could happen because you forgot and you left your laptop somewhere, or your phone got stolen and you had patient contact information in there, or it could be an intentional hack by somebody. So there could be all kinds of ways that data could be breached. It could happen for one individual. It could happen for multiple patients within a practice. So the breach notification rule goes over who you must notify and in what time frame, and may direct you to additional information about what you must do in that particular state. I will say that we are working on products for psychologists related to HIPAA because we know how complicated it is and how it intersects with different states. So certainly turn to the APA and the APAPO for information in that regard, in addition to your licensing board, states, and others. In terms of health information technology, this also is important. Health information technology implementation is intended to enhance the efficiency and effectiveness of healthcare delivery by providing all kinds of tools: electronic health records, clinical decision support systems, e-prescribing within interoperable systems, telehealth applications. And let me just explain what those are. Electronic health records are more than a system on a computer in which you just report information about a particular session that you've had. Electronic health records, to truly be an electronic health record, it is something on your computer system, but it is able to communicate to other healthcare record systems, that you're able to share information electronically. That's the idea. And conceptually, it makes a lot of sense. You know, if I'm visiting my parents in another state and I have an accident and I get taken to the hospital, it would be great if my health information could be accessed by the provider there, and electronic health records would make that so much easier. Or even in my local jurisdiction, if I've got a primary care provider who refers me to a specialist, wouldn't it be great if we could connect content across that? So there's some things there around electronic health records which would be great, but they're challenging, particularly for solo providers. They're expensive systems. They're not often set up for behavioral health, and the kinds of information behavioral health records we want to be sure is extra secure. We don't want just anybody knowing about details of therapy. So we look for particular kinds of electronic health records that can provide extra layers of security and protection for that information. And then there's all sorts of telehealth applications. How do we provide our services via technology? And that's an important emerging area for psychologists to pay attention to. So how does it work? Usually it's going to be video conferencing between the patient and the healthcare provider, who's at a different location. Sometimes telepsychology covers electronic communication where you transmit digital images. Certainly it can do this a lot in dermatology, where you take a picture of the rash and send it off to your provider. But it doesn't include, when we're talking about telepsychology, we're generally not talking about telephone, fax, and email communications, even though those may be helpful for us in doing our practice. In terms of payment, there may be additional requirements about where people need to be located and if some sort of technology needs to be available to mediate that process. And individual payers have different policies on how they pay for the practice of telepsychology. So this is an area to do some research on if you decide to move into this area of practice. We do have telepsychology practice guidelines that cover all of these areas. What do you need to know to be competent? What are the standards of care? How do you do security? What kinds of issues might come up around interjurisdictional practice? How do you maintain confidentiality? What are the good processes you need in order to be a good psychologist providing care through teleconferencing? So those are important tools to know. Telepsychology, we need to be compliant with what the laws are. There's HIPAA and HITECH, which the acronym stands, I can't remember what the whole acronym stands for, but it's within the domain of HITECH, right? So we want to comply with that. We want to make sure that whatever we're doing in terms of the HIPAA privacy and security rule requirements, that we make sure that fits with telepsychology as well. There has to be a business associate agreement with third parties that may have access to your patient's data, even if it's for billing services. But we also need that for teleconferencing services. Anything where there's content about our patients that could be conveyed electronically through these services, we need that BAA to be appropriate to be legal in that regard. The Office of Civil Rights and the Health and Human Services, they can do compliance audits to see if we're doing it right. So you want to have policies and procedures, whether you're in private practice or in some sort of system or organization, for how these kinds of things are going to be stored. If you're in an organization, you may not be the one setting up those policies and procedures, but if an organization is proposing that you start doing telepsych and you're not aware of what those policies and procedures are, you should be asking some questions. And when we talk about teleconferencing, we don't mean Skype. We want to have things that have HIPAA compliant encryption and can convey the kinds of security that's important. Quickly about interjurisdictional telepsychology practice. When we talked about licensing early on, we talked about how each state has different requirements for licensure and that you're expected to be licensed in the state in which you're providing services. And that's typically understood to be where the patient is located. So now you can provide services via technology. I can be in Maryland, you could be in Michigan, I could provide services to you. Where should I be licensed? Licensing boards protect the public. They protect the person receiving services. So they see the person in Michigan as the person they want to protect, which means they want to know about you, the provider. So oftentimes you may need to be licensed in both jurisdictions, and you'll need to understand if there's conflicting laws around duty to warn, duty to report, what the record keeping requirements are. These are all things that you're going to want to pay attention to if you're providing telepsych services across state lines, across boundaries. So I talked really fast because we're running out of time. So if we have additional questions, we'd love to hear them.
Thanks, Lynn. I've got a few. For Dr. Akbar, can you explain the difference between group practice and clinic? And what's the difference between building both?
Again, every state has its own definition. For our state, the Department of Public Health leads the charge around this. We are considered, my practice is considered just a private practice, and we are a for-profit, not a nonprofit. And sometimes you see differences there as well. When you are a practice my size, they tend to be about more on the nonprofit sector. So there are different types of clinics. There are federally qualified health clinics, which receive wraparound monies from the state and from other such organizations and agencies. And then there are smaller practices such as mine that really don't receive any of those benefits. And that's why you have to be a little bit creative, because you don't receive the additional funds, wraparound funds that otherwise would be given to a health clinic. The clinics, by definition, have to have an MD to sign off and to be an attending. If you are identified as a clinic, again, this is in the state of Connecticut, when you are a private practice, you don't have to have a psychiatrist on board. Psychiatrists are extremely expensive. So I wanted to make sure that for my practice, that was something, an expense above and beyond the other expenses that I have that I did not want to incur. I hope that helps.
Yes, I think so. And there's actually one final question for you. What would you say were the key factors that helped you grow your private practice, and any tips you can offer?
I think for me was making sure that I educated myself on how to be an entrepreneur and a business owner. Like many of us have said, there are many things that we are not taught in our training programs. Clearly, we become experts in our subject matter. And, whether it's anxiety, autism, DBT, whatever it is, we're very good at what we do, but we're not very good at understanding how to run a business. So one of the key elements that I implemented is that I continued my training in the area of business just as much as I did in the area of psychology. I put myself through many executive training programs all over the country, learning how to read finances and balance sheets and profit and loss statements, understanding how to create strategic goals, a vision and mission for my organization. So there was a lot that I put into to understand how to grow my business to scale. And what I would recommend is that if this is an area that you want to go towards, that you also make an investment in educating yourself around how to run a business.
Thank you for that. I want to thank everyone for attending our webinar today. Before we go, there are some really good resources available to you. The first is the American Psychological Association of Graduate Students, known as APAGS. Their website is on the screen. The American Psychological Association Practice Organization, which is where this webinar is coming from. Our website is also there. The APA Office on Early Career Psychologists, their Hall of Knowledge, has a wealth of resources and video clips to help you get started. And additionally, the Association of State and Provincial Psychology Boards, ASPPB, has a wealth of resources about all of the licensing requirements for individual states and the licensure exams that you'll need to take. Again, thank you for attending today's webinar, and thank you to our presenters. A link to today's recorded webinar will be emailed to all registrants within 24 hours. In addition, the slides and the recording will be available on the APA Practice Organization's website in a few weeks. We'd really like your feedback on this webinar. It was the first one targeted at graduate students, so we'd like to hear what you thought. There will be a link in your email coming soon. We'd appreciate it if you'd take the time to fill it out. Thank you, and have a great day.